Hi and welcome back to another video of Medic Notes. This video is on medial collateral ligament tear. The medial collateral ligament is the most commonly injured ligament of the knee. The MCL primary function is to act as a valgus stabilizer of the knee, and is most often injured when external rotational forces are applied to the lateral knee, such as an impact to the outside of the knee. This picture shows the ligaments in the knee joint. This is the medial collateral ligament, in green color. Next, for grading, MCL injuries can be graded from 1 to 3. Grade 1, mild injury, with minimally torn fibers and no loss of MCL integrity. Grade 2, moderate injury, with an incomplete tear, and increased laxity of the MCL. Grade 3, severe injury, with a complete tear and gross laxity of the MCL. Clinical features. A medial collateral ligament tear will typically occur after trauma to the lateral aspect of the knee. The patient may report hearing a pop, with immediate medial joint line pain. Swelling tends to follow after a few hours, unless there is hemarthrosis. On examination, there will be increased laxity when testing the MCL via the valgus stress test. There will be extreme tenderness along the medial joint line, but may be able to weight bear. Differential diagnosis include fractures, meniscal injury, and multi-ligament tear, especially MCL and ACL. For investigations, any patient following trauma with significant knee pain and swelling should have a plain film radiograph to exclude any fracture. MRI scan is the gold standard investigation to assess the extent and grading of tear. This picture shows the MRI scan showing a MCL tear. For management, the management of an MCL injury is dependent on the grade of injury. For grade 1, rest, ice compression, and elevation. With analgesia, strength training as tolerated should be incorporated, with an aim to return to full exercise within around 6 weeks. For grade 2, analgesia, with a knee brace and weight-bearing training is tolerated. Patients should aim to be able to return to full exercise within around 10 weeks. For grade 3, analgesia with a knee brace and crutches, patients should aim to be able to return to full exercise within around 12 weeks. For complications, the main complications following a MCL tear are instability in the joint and damage to the saphenous nerve. That's all for this video. Thank you.